Welcome! Today, we're going to walk through how to correctly and safely give medications right into the ear. Okay, so let's dive into this. Giving eardrops seems like one of the simplest things you can do, right? But the little details, they are absolutely crucial for making sure the medicine works, and most importantly, for keeping everything safe. So let's master those details together. First things first, like any procedure, success starts with preparation. So before we do anything else, let's get all our equipment laid out and ready to go. So for your standard eardrop situation, this is pretty much your basic kit. You're going to need clean gloves, of course, the right medication with its dropper, some cotton-tipped applicators in case you need to clean the outer ear, and a few cotton balls. Nice and simple. Now, if you're doing an ear irrigation, which is basically a flush, you're going to need a bit more stuff. Think a moisture-resistant pad, a basin to catch all the fluid, a syringe, and the solution itself. And hey, pay close attention to where it says warm solution. This is a big deal. If you use a solution that's too cold, it can mess with the inner ear's balance and make someone feel really dizzy or nauseous. So you always want it right around body temperature. All right, let's talk about the absolute foundation for safety. Before you even think about giving the medication, there are 4 checks you have to do. Every single time. These are your safeguards against making a mistake. I want you to think of this as a pre-flight checklist. First, you match the medicine to the record and you check that expiration date. Second, you make absolutely sure you have the right person. Third, you tell them who you are and what you're about to do, no surprises. And last but not least, you wash your hands. You do every step, every single time. Okay, our prep is done, our safety checks are complete. Now we're ready for the main event, actually giving the eardrops. Let's walk through the technique to get this done perfectly. Now, this slide right here highlights the single biggest difference in technique, and it all comes down to simple anatomy. You see, an adult's ear canal has this slight S-curve. So by gently pulling the outer ear, the pinna, up and back, you straighten that pathway out. But for a child under 3, their canal is a little different. It's shorter and more horizontal. So for them, you pull the pinna down and back. It's a tiny change that makes a huge difference in getting the medicine where it needs to go.
So here's the play-by-play. Get the patient positioned comfortably with the ear that needs the drops facing up. If you need to, give the outer ear a quick, gentle clean. Then, holding the dropper just above the ear canal, let the drops fall onto the side of the canal. After that, a few gentle presses on that little cartilage flap in the front, the tragus, helps work the medicine down. And finally, just have them stay put for a few minutes so it doesn't all run out.
This might seem obvious, but it's such a critical rule for infection control. You never, ever let the tip of that dropper touch the patient's ear. The second it does, you risk contaminating the dropper and the entire bottle of medication. Okay, let's switch gears and talk about ear irrigation. This is that flushing procedure, maybe to get out earwax or a foreign object, and it really requires a specific technique to do it safely. Communication is absolutely everything here. Before you start, you need to tell the client exactly what to expect. You might feel a little fullness in your ear, some warmth from the water, maybe a little bit of discomfort. Just letting them know what's coming helps them relax and prevents any surprises. So for the irrigation, you'll get the client positioned with their head tilted and have that basin ready to catch the water. After you straighten the canal, just like before, here's the real key. You aim a slow, gentle stream of that warm solution against the roof of the canal. You are not aiming it directly at the eardrum. That's so important. A direct shot of water could damage that sensitive membrane. Aiming for the roof lets the fluid flow in gently, swirl around, and then flow back out without building up any dangerous pressure. All right, the drops are in, or the irrigation is done. The main event is over, but we're not quite finished. Let's go over the final steps to wrap this up properly and make sure everything is documented. First things first, make the patient comfortable. If you did an irrigation, have them lie with that ear down to help it drain, and you can stick a loose cotton ball in there to catch any drips. Then off come your gloves, wash your hands one more time, and, this is critical, document everything right away. You want that charting to be accurate and immediate. And this brings us to our final and maybe most important point. The procedure isn't really over just because you've documented it. Your job now is to evaluate the patient's response. Did the medication do what it was supposed to do? Are there any side effects? Following up is what closes the loop and completes the cycle of excellent care.